Infectious skin disease in swine. Viral diseases are swinepox and porcine dermatitis nephropathy syndrome. Bacterial diseases are greasy pig disease and ear necrosis, as well as erysipelotrix reusiopathy, salmonella. The parasites are mange, lice, mosquitoes. The fungal causing diseases are microsporum and candida. The notifiable diseases which cause vesicles and blotches are foot and mouth disease, vesicular stomatitis, swine vesicular disease, classical swine fever, and African swine fever. Swinepox, it's caused by the sweetpox virus. It occurs mostly in growers around 3 to 4 months old, but it can occur in all ages. There's a vertical spread, so congenital pox is spread in the newborns, and the shedding is done in the dry crusts. It occurs when there's poor hygiene, lice, and other blood-sucking insects. Signs are rarely systemic signs. They usually occur around the abdomen, the inner thigh, and the whole body. Small macules appear, and then papules can be visible, and then vesicles can occur, then pustules and crusts develop. It can affect the mucosa of the alimentary canal and the respiratory tract, especially in the congenital form. It makes them very vulnerable to secondary infections from Staphylococcus hyacus. In the histopathology, we can see eosinophilic cytoplasmic inclusion bodies. For the differential diagnosis, it can be masked by secondary infections, or it can be chronic bacterial dermatitis or fungus, mange, or allergies. For porcine dermatitis nephropathy syndrome, caused by porcine circovirus 2, causes an immune complex dermatitis vasculitis, which is a type 3 hypersensitivity. It occurs in fattening pigs around 3 to 3.5 months old, but it can occur in all ages. The signs are purple hemorrhagic blotches on the skin. It starts off as a crust and then leads to necrosis, a falling off, and it becomes a scar. It occurs on the perineum, head, and legs. And the clinical signs are fever, depression, diarrhea, and anorexia. Large lymph nodes can be seen. In pathophysiology, we can see skin lesions and enlarged lymph nodes, and an increase in peritoneal fluid. The kidneys become enlarged, pale, and small hemorrhages. And in the GI, you can see ulcers and bleeding. Differential diagnosis can be classical swine fever or African swine fever. For the treatment, make sure there's palliative therapy, have dry, warm bedding, and fluid therapy. For greasy pig disease, also known as exudative dermatitis, it's caused by Staphylococcus hyacus. It is an exfoliating toxin. It occurs in nursing or weaned piglets around 1 to 5 weeks old, and the predisposing factors are immunosuppression, especially from PRRS, porcine circovirus, mycotoxins, injuries, or cold. The signs are brownish, squamish spots on the skin, on the face or legs, back, or abdomen. They darken and then they spread, and they look greasy and exudative. There is no pruritus and no fever. It occurs in young animals and it causes anorexia, weakness, and death. Differential diagnosis is mange, but mange has pruritus. For the treatment, give antibiotics after a resistance test, and the typical antibiotics are penicillin, cephalosporins, and potentiated SAs, and fluoroquinolones, and tylosin. Prevention, have teeth clipping and remove sharp objects from the crate, and avoid injuries and have good hygiene. For ear necrosis, the cause is unknown. It can be a secondary infection from Staphylococcus hyacus, or B. hemolytic streptococcus, lysine deficiency. It occurs in weaned piglets and fattening pigs on farms with poor hygiene. Signs are skin inflammation, which then becomes ulceration, which then leads to necrosis. The animals have fever, lethargy, and anorexia, and arthritis. There's septicemia if there's a hematogenous spread. For the treatment, you disinfect the ears with iodine, and then you use preventive antibiotics after a resistance test. And for prevention, have good hygiene, teeth clipping and avoid overcrowding, and have the porcine circovirus vaccine to avoid immunosuppression, and give lysine supplementation.